Alright, so today we're looking at the chest and observing that. We're going to start off by just looking at the lips, seeing if they're blue or if the fingers or fingernails are discolored. They'd be like a yellow, anything like that. Heel looks good, so that's a plus. Next we're going to look at the trachea. First we're just going to inspect it, see if we can see that it's deviated anyway. Then we're going to have them swallow. Good, and there we're just looking again. If it deviates one way or another, make sure that it goes up symmetrically. All looks good. Next we're going to do, it's called the tracheal tug test. I'm going to put a finger on the trachea, and then just have two other supporting fingers and have them swallow. Good. So there I'm just feeling that that I can feel the trachea tug up on my finger. So after that, we're looking at from front to back first. We're going to look at his chest and just his body in general. I'm going to look at it for any abnormalities, just ask him to breathe normally. Make sure both sides of the chest expand and go in together. After that, I'm going to palpate by, you're going to feel my hands on your back and on the front of your chest, okay? So we're just going to do this. We're just going to have you take a normal breath in. Good, and now a deeper breath. Good, and there I'm just feeling that the deeper breath should push my hand further forward. Next we're going to do the same thing laterally that we just did. So again, just have him breathe normally. Look for any abnormalities. Now we can look at the back and the front at the same time. We can see if his secondary muscles are being used a lot more in his traps, scalenes, those sort of things. The next thing I'm going to do is palpate his chest from the back and from the front and make sure that that's just for symmetry of the left and right side, making sure that they're operating together. So I'm just going to place my hand here and you can take a deep breath in. Good. And again, that's just making sure that my thumbs separate the same amount on both sides. So same thing here in the back. Good. And both of them separated the same distance, so that was good. Next thing I'm going to do is do some palpation. It's tactile palpation first. We're going to start in the front and then we're going to go to the back. So patient, whenever you feel my hands on you, can you just say 99 for me? Mm-hmm. Stick here.
99, 99, 99, 99.
Good. And we're just going to go to the back. And same thing here.
99, 99, 99, 99, 99.
Good. So next is a percussion. So patient, you can just relax and yeah, I'm just listening for the sound that I make from the percussion. And there we want to make sure that our finger's flat and we're using our fingertips and making a good strike. After that is the lung auscultation. So the first thing I'm going to do is listen from the back. Patient, I'm going to have you cross your arms in front of you and then flex your head forward. And you're just going to breathe quietly and a little bit deeper than normal. And we're going to listen to this in the ladder formation. So you can good. Next, we're going to do this from the front. Same thing. I just want you to breathe a little bit deeper than normal. The first two areas, which are going to be right above the clavicle, we're going to listen to with the bell, and then the rest areas I'll listen to with the diaphragm. So same thing, just breathe a little bit deeper than normal. Good. So next is vocal auscultation. So what we're doing is using the diaphragm again and listening and having him say 99 as I do it. That's the first one. Alright, so every time you hear this touch your skin, just say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99.
Good. And then the next one, I'm just going to have you say E when you feel it touch your back.
E, 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 E.
And the last one, I'll just have you say blue moon, but you have to whisper it this time whenever you feel it touch your back. Alright, and that concludes the chest examination.